The human heart is one of the most important organs of the body. It is made up of mostly muscle, and it is divided into different parts that work together to pump blood throughout the body. The heart pumps blood to every organ, and every organ needs blood to stay alive. It is a little bigger than a closed fist, and it weighs 10 to 12 ounces in men and 8 to 10 ounces in women. Together, the left and right ventricles, the left and right atriums, several valves, veins, and arteries make up the heart's blood flow. This blood flow is a cycle that starts by receiving the oxygenated blood through the inferior vena cava. Then, the blood goes to the right atrium. The blood is pumped through the tricuspid valve into the right ventricle. Then, the blood goes to the pulmonary trunk. From the pulmonary trunk, it goes to the lungs, where it releases carbon dioxide and absorbs oxygen. After this, the blood returns to the heart through the pulmonary veins. From the veins, it enters the left atrium. When the left atrium contracts, the blood goes into the left ventricle. In the left ventricle, the blood is pumped into the aorta. From the aorta to the systemic circulation and goes to the body tissues. Then it returns through the heart via the vena cava. In some cases, the heart's blood flow and cycle is interrupted and the heart cannot complete its duty, which might cause damages in the body. These interruptions lead to heart attacks. And what is a heart attack? A heart attack is when a part of a tissue of the heart dies due to the lack of blood supply it receives. Every part of the heart is connected. If one fails to make its job, the rest will also be affected. Heart attacks are also called myocardial infarctions by medical professionals. When the heart doesn't receive enough oxygen, it is called cardiac ischemia. As this happens, it causes damages and injuries in the person's body. 85% of the injuries are caused in the first 1 to 2 hours after the first heart attack occurs.
Jess, I'm coming round. Come on, sit down for me all the way down.
The most common symptoms are chest pain and breathlessness. Other symptoms are feeling lightheaded, vomiting, and feeling dizziness. Heart attacks are caused when a blood clot is made inside a coronary artery. This is called atherosclerosis, which is when a waxy substance called plaque builds up in the artery wall after a period of time. As the amount of plaque increases, it breaks and clots form. As the waxy substance interacts with other blood vessels, chemical interactions happen which cause the formation of clots. As clots become bigger, the blood path becomes smaller, not allowing the blood to flow smoothly. The other way the blood flow might get interrupted is when the artery suffers a spasm. A spasm is when there is a tightening in the artery. Some of the factors that increase the risk of having a heart attack are age, high blood cholesterol, diabetes, genes, high blood pressure, overweight, no exercise, smoking, stress, gender, and people who have had previous heart surgeries. When a patient arrives to the hospital, electrocardiograms, cardiac enzyme tests, and chest x-rays are made to check for heart attacks. If a person is diagnosed with a heart attack, there are different treatments that can be made. One of the treatments is doing a angioplasty, also known as a percutaneous coronary intervention. The result of this procedure is opening the artery that suffered the obstruction to allow the artery to have a proper blood flow by applying stents. Another way to treat heart attacks is by applying a pacemaker to the heart. Doing a coronary artery bypass surgery is another treatment for heart attacks. This procedure changes the blood flow's path. Arteries and veins from other parts of the body are used to form paths around the heart's blockage. In severe cases, where the heart damages are very big, heart transplants are made. It's important to know about heart attacks because they are one of the most common causes of death. In fact, it is the #1 cause of death in the United States, and 16% of the deaths in Costa Rica are caused by heart attacks. Knowing about the symptoms, causes, and treatments of heart attacks can help you know how to react during emergencies.